My name is Sid Kakodkar. I'm a cardiac electrophysiologist. I work at Methodist. I go to both hospital sites in North and South Lake campus. My clinic is mainly in South Lake. So pulse field ablation is a newer technology that came out early this year that is a different method of applying ablation lesions in the left top chamber of the heart. We target the area in the heart called the pulmonary veins. That's usually the trigger point for atrial fibrillation. And over the last 15-20 years, the main method of applying those ablation lesions was by radiofrequency ablation, which is kind of like heating up the tissue to create that area of scar. The problem is there's risk to it. It can affect surrounding structures such as your esophagus, the nerves in the area, lung tissue. And so now with the newer technology called pulse field ablation, it only affects the cardiac tissue. So it's a much safer way to apply these lesions and not worry about how it'll affect the esophagus or the nerves. And each lesion is a few seconds long. So it's a very quick and efficient way to do the procedure. And once we're done with the procedure, patients feel pretty good. They're able to go home the same day over 90% of the time. So that's why most hospitals will likely adopt pulse field ablation in the near future. Methodist Hospital is the first hospital in Northwest Indiana to have this technology, and we have already been doing a lot of cases, and it's been working out pretty well. So atrial fibrillation is the most common arrhythmia that we see in this country. It's an irregular rhythm that starts in the top chambers of the heart, and it's associated with stroke. And the more you have AFib, the more you can develop a congestive heart failure. And so the most common symptoms in atrial fibrillation are fatigue, loss of exercise tolerance, and shortness of breath. And some patients don't realize that they're in atrial fibrillation until they have a stroke. So there's a big push now for improving diagnosis of atrial fibrillation, and when possible, getting them back in normal rhythm. There's a lot of data now that shows that staying in normal rhythm is better for you long term, keeps you out of the hospital, potentially live longer, versus remaining in atrial fibrillation. And just in the last 5 to 10 years, there have been a lot of advancements with treating atrial fibrillation with that goal in mind, to the point where the current guidelines now state that it is a Class 1A indication to undergo AFib ablation as a treatment for your AFib versus medical management. The patients are placed under anesthesia, so they won't feel any pain or discomfort during the procedure. I place a few IVs through the vein in their right leg. Catheters will go through those IVs up to the heart. Then we go into the left top chamber of the heart. That's where those pulmonary veins are. And we place those catheters, the pulse field ablation catheter, which looks like a loop. We place that against the pulmonary vein, and we apply a few lesions to electrically isolate the veins. Usually after 2 lesions, the vein is isolated. And remember, each lesion takes about 3 seconds. And so we apply a few more lesions just to make sure that there's no chance of those veins reconnecting. Now, the blood flow through the veins remains intact. We're talking about the tissue around the veins. So that sometimes comes up, am I losing blood flow to the heart? No, not at all. Once we finish doing that, we'll do something called an electrophysiology study where we pace the heart fast, see if there's any other arrhythmias that pop up. If there's nothing else there, we'll take all the catheters out, we watch the patient for a few hours, and as long as they feel okay, they can go home. The main difference is how the energy is applied. Because of how pulse field ablation works, it only affects the cardiac tissue. So it does not affect the esophagus, the lungs, or surrounding nerves. And because of that, we know it's a safer technology to use. So that's the main reason the safety profile is improved. Otherwise, the procedure itself, as far as how we get the catheters to the heart, it's essentially the same. It's just the safety and how we're applying those lesions. Any patient with atrial fibrillation can be considered for ablation therapy. They have to be, I have to evaluate them in clinic to see, what their level of symptoms are, how how aggressive they want me to be with their management versus medications. But most patients end up preferring to do the ablation because there's a chance you could be cured of the arrhythmia, feel better, live longer, stay out of the hospital. There's a lot of benefits that come with ablation therapy over medical management. Our cardiac electrophysiology lab is in our outpatient building at Methodist Southlake. And it is a state-of-the-art facility. We have the state-of-the-art mapping systems, the most state-of-the-art ablation system and pulse field ablation. And we're set up to pretty much do any type of procedure very efficiently. And we're also self-contained in that the post-op recovery area is right connected to the lab. The staff is very well trained, and we've had great feedback from the patients with how engaged the staff has been with making sure they feel great before they go home.